facility on their own, nakita mo na Friday, Saturday, Sunday, ultimo ang mga tao nagsiself-regulate na. Ultimo sila, hindi na sila lumalabas.
The health department logs over 33,100 new COVID-19 infections today. The Opta Research Group is warning of challenges in COVID-19 monitoring once daily infections go beyond the country's testing capacity.
Kunyari, 50,000 capacity natin. Umabot na tayo ng 50,000. Then, nag-increase pa siya to 100,000. Hindi natin makikita yung 100,000 yun. We don't know if it's 100,000. We don't know if it's 200,000.
Metro Manila's workforce and households are falling ill of COVID-19 as the Department of Health continues to tally another record high number of cases. Now, should government impose stricter measures to prevent transmissions? We discuss in this episode of The Chiefs. Welcome to this Monday edition of The Chiefs. I'm Ed Lingao. Also with us, Ana Marie Pamintuan of the Philippine Star, Luchicus Valdez of News 5, and Robbie Lampay of One News. Robbie and ladies, happy Monday.
Happy Monday.
Well, not very happy actually. 33,000 na naman.
Yeah, and 46% positivity rate. We're nearing 50. Ibig sabihin, halos kalahati ng mga nasa testing center, meron ng COVID.
Saka kahit hindi nagsisipunta sa hospital, kaya hindi naman pa masyadong marami na hundreds of our healthcare workers are getting sick. Kaya yun ang problema. Walang tao, may bed ka, wala kang tao. Yun ang problema.
And the ward occupancy is rising. In Metro Manila, it's 67% na.
Umakit na nga.
Diba? 70% is parang danger zone
Sabi ng hospital group nga, even the private and even the government hospitals.
And sa lagay na yan, ang dami ng tao who are, fortunate to report that they're getting mild symptoms. Actually, as you both know, in my case, I did get a positive result. Pero thankfully, just like most of what we're hearing, mild, especially doon sa mga nabakunado na, no? But imagine yung mga nag-home test and yung mga wala pa yan doon sa mga numerong nakikita natin.
Yeah. Actually, okay pa nga tayo kasi we're in Metro Manila, which is 90% of the target population already vaccinated. But what about when COVID and Omicron moves to the countryside where you're looking at 28-30% vaccination lang? That's going to be a bigger problem.
We're waiting for an announcement tonight by President Duterte. Pero in the meantime, siguro tanungin natin yung anong gusto ng mga businessmen, no?
Yeah, si Ami talaga, kahit New Year, old segues pa rin. Okay, Ami, thank you. We'll bring it to, for our first guest for tonight is Secretary Joey Concepcion, Presidential Advisor for Entrepreneurship. Secretary Concepcion, thank you for joining us and welcome back to the Chiefs.
Good evening.
Good evening, sir.
Hi, sir. Sir, we were talking kanina about well, the numbers are going up and more than that, the positivity rate is talagang the highest it's been. We're almost hitting 50%. Now, we do understand that it's still manageable so far. The bed rates nationally are still manageable. They're around 40% thereabouts, ICU, wards, and isolation. But of course, sir, the concern of many people is that it's only the start. It's only the start of what may be a surge this week and next, which raises the question na should we be cutting back more on mobility than we already have?
Well, actually, if you're to ask me, what are we going to cut back? If you can see already, the first quarter of the year is the slowest quarter, no? So most establishments are barely at a decent capacity. Matubal kasi yung negosyo in first quarter. And not only that, lahat ngayon takot kasi you just talk to anybody, every family is infected. My family, about 2 or 3 have been infected, my daughter. But all of them have gotten, they went through it with a breeze, no? And then, very mild. And if you're able to get this drug called molnupiravir,
yes,
it works quite well, no? So hope then there are more suppliers for this drug coming out, no? So that's going to be good. Prices will go down. No? So if they want to bring it to alert level 4, which I don't think is necessary, because people are not going to be mobile. The mobility from the fourth quarter to the first quarter has a huge drop. No, eventually you'll see it's really with very few cars and quite quiet. No, so
Actually,
I think
sir, ngayon pa lang, sir, nasa alert level 3 pa lang tayo, which is not as strict as we had been last year. Pero ngayon, ang luwag ng EDSA parang people have taken it upon themselves to stay home generally.
and everybody's hit. Our offices, ang daming tinamaan. The people in Go-Negosyo, maraming tinamaan. Nobody is spared with this. The only, in a way, in a sense, the blessing of Omicron. In fact, if you were to choose between Omicron and Delta, people would think maybe Omicron is better because it's milder. No, so far, out of the friends I've talked to, most of them have gone through it quite well. No, so let's just brace to this surge. No, it's going to happen. Octa feels that it can last maybe till the end of the month, maybe at most February, and hopefully it will start to taper off. Yes, your concern is the unvaccinated, and that's why the Metro Manila mayors have done the right thing, is to restrict the movement of the unvaccinated, which we've been calling since last year, because these are the people that will flood the hospitals. No, they have totally no protection at all, unlike the vaccinated. The reason why they are having it much lighter is because they have developed some level of immunity, while we can still infect each other. The most important here is we're protected from severe infection and hopefully hospitalization. No?
Mr. Concepcion, speaking of bracing, yung fourth quarter natin last year, as everybody knows, you did lobby to put everything in place para at least we'll have a good fourth quarter, especially the small entrepreneurs, the businesses. How did that go? I mean, I think kita naman natin lahat, and we're also seeing the implications of that. But just on the business side, especially considering that we enter now this first quarter with Omicron, slowdown in business, people no longer wanting to go out after overcompensating in the fourth quarter. But in terms of bracing for these difficult first 3 months again, how did the fourth quarter fare?
Well, if you look at it, when we called for the lockdown on August 8 last year, upon the advice of Octa, that was the right move. We saw the cases go down. We saved the fourth quarter, which is the most important. Can you imagine that if we didn't do that, that Delta really hit us bad in the fourth quarter, and in the first quarter, Omicron hits us also? How many people will be left standing with 6 months of challenges? No, so the fourth quarter, most of the businesses did at least 80% of pre-pandemic sales. That's excellent. No, you could see there was a lot of mobility. People shopped, people celebrated, and that's part of living with COVID. We have to learn to live with COVID, and yes, the surge definitely happened after that because of greater mobility. Without mobility, the economy will not be moving. So you really have to have mobility. And moving forward in the first quarter, at least many carried forward. They at least paid their 13-month pay, which is important. Most of them were able to do that. They have bank loans to pay. They have suppliers to pay. So all of that they've been able to do. No? And they have maybe some puhunan for them to carry forward in this next quarter, which is the most challenging quarter of the year, when things really slow down because naubos nila ang pera nila for all of these gifts and celebrations. And without having to bring it up to alert level 4, it will go in that way already, because people are not going to go out because of the fear of both Delta and Omicron in the country now.
Mr. Concepcion, I think the Metro mayors have already agreed that we should not go up to alert level 4, and I think Malacanang is going along with that decision. Are there any other measures that you want to see that can be implemented by the national or local governments just to keep the economy afloat during this crisis?
Well, I think the best thing that has happened is the Metro Manila mayors have restricted the movement of the unvaccinated by, really getting them to stay home, and that's for actually their own safety and their own health. No, because if they get sick, then we have problems. I hope that this will be replicated by the rest of the LGUs in the provinces, our governors. Hopefully, they can implement the same thing that the Metro Manila, so the entire Philippines somehow restrict the movement of the unvaccinated so that our hospitals will not be overwhelmed. And more importantly, our healthcare workers. No, I mean, that's going to be a challenge, the healthcare workers. We can see that also in the airlines. We can see that everywhere. Even our front line are affected. Many of our merchandisers are affected. Everybody out there in the field exposed right now, the level of infection is tremendous. As you said, the positivity is close to 50% by now. So the same thing is happening in the private sector. So what more, the unvaccinated, we have to protect them by restricting their movement. And in that way, we have the arsenal. We have 100 million, close to 100 million doses right now of vaccines. So we have to do that because we have to really put a sense of urgency, that those unvaccinated should not wait. They should take the vaccines because it's right there in the storage. So this move of the Metro Manila mayors hopefully will be replicated all over the country.
Yes, sir. Let's welcome in rin, the very colorful Lucy Cruz Valdez, who
Colorful talaga.
who brightened
Ano nangyari
the
yun?
night.
How did I do that? Oh, by the way, I
By being yourself.
Hi, Mr. Concepcion.
Lucy.
Yeah, my question to you is, are you imposing a deadline for yourselves in terms of being able to hold out, under the circumstances, even assuming that alert level 4 will not be declared. At the rate we're going now, nobody's going out, nobody's going to the mall, everybody's scared of catching COVID. But how long do you think business can withstand this kind of fear, knowing how really, it is yet to peak, and we haven't seen that?
Well, the good part here is that, as we've seen, those getting infected are mild, So it's not like it's a death sentence, I mean, that's the reassurance that we're seeing. All our friends are getting sick. It's a cold, like my daughter, it's a cold. And then, if they take this molnupiravir, it helps a lot, especially if you take it early. So hopefully the one of Pfizer arrives pretty soon. That's going to be even much, much better. So these medicines will help us go through. And of course, we all have to get the rest vaccinated. And the more people that get vaccinated, the better it is. That we will be able to get to learn to live with COVID. It's going to be like the flu. I think you see it yourself. It's like the flu.
Yes, sir. But I guess what I'm asking is, for example, February will soon be here. It's Valentine's month. People will want to spend and go out on dates, katulad nila Ed Lingao.
Hindi, matipid ang Valentine's ngayon.
So I'm wondering how does it look to you if this surge continues on to February?
Well, of course, the first quarter is bad. But at least we had a good Christmas and a good New Year. Valentine can take a backseat for the time being because you don't want to get sick at this point in time. So I think the lovebirds will have to just wait for a while,
Yes, sir. We don't want close contacts on Valentine.
That will be worse.
For the record, we are just following the advice of Secretary Concepcion.
But Secretary Concepcion, the unvaccinated are also kind of like, well, they're not up in arms, but they're feeling really discriminated against. And they're saying, teka lang, saglit ha, kayo ang maraming infected, kayong mga bakunado. Kami, konti lang nga kami. Kami nga ang nahahawa sa inyo eh. Hindi kami ang nahahawa sa inyo. So bakit kami ang pinaparusahan nyo? This is their logic. And I do understand it. It sounds rational. In my household, I'll tell you, everybody had COVID. Now, except for them, not except, and including the one unvaccinated person here who is our cook, And nahawa sa kanya kasi lahat kami bakunado at nahawa namin siya. So I get the point of the unvaccinated and those who refuse for medical reasons or health reasons. What do we say to them?
No, the vaccines are not basically, even if you take the vaccines, you will get infected. We've seen that from as early as months back. No, what the vaccines prevent us is from getting severe infection and even and death. No, so that has been proven with all the different variants from alpha, beta, and delta, and now Omicron. So the immunity is boosted with the vaccines, and it makes that the virus mild when it hits our body. So that is the biggest benefit. And clearly, if you look at the hospitals, those that will troop to the hospitals are primarily the unvaccinated. So what we're doing is it's not cutting down the right to movement. It's the mayors are right. You restrict the movement because you want to protect them from getting sick. And when they get sick, then the hospitals get full and the healthcare workers get stressed. No? They will not be able to manage that number. And that's when you will have maybe a harder lockdown because there will be long lines in the hospital, and hopefully we don't get to that point. No?
Yes, sir. But sir, I think what we're talking about so far right now are Metro Manila's numbers, and they are good compared to what happened nung Delta, and that's because we had massive vaccination in Metro Manila. Pero ang problema in probinsya, sir, where the vaccination numbers are really much lower. ARM has 9% lamang ng kanilang population na vaccinated. The others are 28, 32, and so on down the line. We might be looking at a completely different set of numbers and patterns if Omicron spreads to the countryside where less people are vaccinated.
I agree, and that's the biggest challenge, and that's why the urgency for our LGU heads in the provinces, especially those with a low vaccination rate, should really ramp up vaccination. And hopefully they will follow what the Metro Manila mayors are doing, is to restrict the movement of the unvaccinated in the provinces so that they don't get infected. So they have to want to take the vaccine, or else you will see a major catastrophic thing in these areas, because the level of vaccination, because there is still vaccine hesitancy in these areas. So, and that's why the focus is to get them vaccinated. So what else do we do? There are now restricting movements from LGU to LGU. People who are vaccinated can have more movement, and those who are unvaccinated cannot cross over to the other LGU. So I think this thing will somehow force the unvaccinated to have a sense of urgency and troop to the vaccine centers, take the vacuna. No? There's no other solution to this in my mind but to take the vaccine. No?
I'm sorry, I have to break it lang very quickly. We just have to go into a quick break, very quick break, but we will be back with Secretary Concepcion. We'll just go into break, so please stay with us. Welcome back to the Chiefs on One News. We continue our conversation with Secretary Joey Concepcion, the Presidential Advisor for Entrepreneurship. Robbie, I think you have a question.
Yes, thank you, Bok. Secretary, kanina po, nabanggit nga ni Ami, nabanggit niyo rin, it doesn't seem like for the moment that we will revert back to alert level 4. But apart from convincing government not to bring us back to alert level 4, ano pa pong kailangan ng mga businessmen natin ngayon?
Well, I think we have to brace, no? Because this may be out there for quite some time. Hopefully, we see an end to this by maybe at the latest February, God willing. And I think the medicines that are out there that can be used for this should be deployed. Secretary Galvez said that the Pfizer version should be arriving by the end of the month or maybe early February. So we have these armaments that can help us recover quickly. As I said, one is more Piravir, no, that's one, and that's here. And there are 3 suppliers already producing it and making it available at much lower prices. So we will be able to manage. The private sector at least survive the fourth quarter. They have enough reserves to carry them forward in this next quarter, and hopefully this wave will eventually die down. No? And we've seen that in other countries. In South Africa, it went up and it tapered off. No? So I'm optimistic that 2022 will definitely be a much better year than 2021 for the very reason that we have 100 million vaccines right now in the country. No?
Can you expound a bit, sir? Maybe share on the access, affordability, and the availability of Molnupiravir, Paxlovid, and so on. Eh, karamihan sa amin nasa paracetamol pa lang, nagkakaubusan na eh. But if you have any news, any updates on these medicines in particular, kamusta po ba?
Well, Molnupiravir is being sold by Qualimed, one of the Yalap companies. No? So they have a lot of stock that's being sold at about 5,000. There's a group of Faberco that's selling it at 3,000. And we've got Lloyd Lab also somewhere at about, I'd say, close to 4,000, thereabouts. So, but as more of these companies roll it out, there'll be more competition, and these prices will go down. Definitely. So it will be affordable. And I've seen it work with my daughter, and we had discussed this in the town hall meeting last week with Dr. Solante, and he definitely says that it does work. No, although the official report says the efficacy is about 30%.
Yeah.
Yes, but I've seen it for myself. We gave it, my daughter got well in 3 days. We gave it to our yaya, and she, after taking it, got well, and many others. No? So it will work. I think you can talk to the doctors out there who are prescribing it. I think this is what we can use. No, of course, even without it, we have seen people recover. No, it looks like a bad cold or a bad flu. No, depends on your level of immunity, I guess. No. But I'm confident, that we will get through this. We have gone through this. We're 22 months into this game of against this challenging virus. But I'm optimistic that we will see one of the best years this year. No, let's have confidence, and let's spread more optimism than pessimism, and let's not panic. No?
Secretary, you've spearheaded the initiative to procure vaccines. Is the private sector also discussing any initiative to make testing more accessible? That's one of the problems at this point in this Omicron wave, the testing.
Well, it's
And
not,
a proposal to make it free, to give it for free. Yeah.
Yeah, I don't think we're the only country having this problem. Even in America, they ran out of test kits, antigen kits. I'm supposed to leave this weekend for the States, so I'm bringing a lot of test kits with me now. So they have the same problem there as well. And here we have antigen kits that are available. If you can't get an RT-PCR, the antigen works as fine, and at least you can act immediately. But right now, to get the results, because of the number of people getting tested with RT-PCR, the delay is so long. No? So you're better off taking the antigen. And once you're positive in the antigen, definitely you are positive. So I think we will be able to cope. There is a lot of supply of antigen kits. And if anybody needs to be referred to suppliers, we can do so also as well.
How is your initiative for vaccine procurement? Is it going to be further ramped up in the coming months?
My worry is that we have a lot of vaccines in the country, and basically we have to use these vaccines. No, they don't last forever. They have a expiry date of 5-6 months, and the challenge is that we have a huge number, and we have to get our citizens vaccinated, especially the boosters. No, and I'm glad DOH and FDA approved the 3 months. No, so that's a big help. So rather than wait for 6 months, I basically took my booster 4 months after the second dose, and I've been exposed to a lot of people, and thank God that gave me enough immunity. When I looked at my antibody test, I was 250 points, and the normal is basically 0.30. So that's a lot of antibodies. So I guess if we are able to take these boosters immediately, the private sector is rolling it out right now, no? Since it was approved during Christmas time. But of course, we are faced with a lot of challenges. A lot of employees are also sick, so they can't take it, so they have to wait. But we are rolling it out as fast as we can to get our employees, protected. And if they get hit by Omicron, with these booster shots, it will be mild. No?
I'm curious as to how the elections are affecting or not affecting businesses right now. I mean, in tandem, of course, with the pandemic. But are you feeling, for example, the windfall that some businesses used to experience in past elections going away or diminishing at least this time because of the pandemic? Are you feeling any of that?
Well, if you're saying the election fever improved consumer spending, for Christmas, definitely a lot of LGUs went out to purchase essential products to give away. I think the election spending this year will be delayed. It's still a big question. No? If this stays on for quite some time, I don't know what will happen to our elections. So I'm optimistic anyway that I think this will be hopefully over by Feb or March. No, if it drags on towards the election, it's going to be challenging to have an election. People campaigning with this kind of atmosphere, it's going to be a really super spreader if that happens. So let's hope that we get the vaccines out to our people as soon as possible. Of course, the infection level is causing the delays in vaccination, but we just have to push harder. This is the only way that we can provide enough protection, especially to our unvaccinated citizens.
Okay. Secretary Joey Concepcion, Presidential Advisor for Entrepreneurship. Sir, maraming salamat for joining us tonight. At ingat po.
Thank you.
Thank you,
and
sir.
Maraming
Happy
salamat
New
po.
Year.
Happy New Year po.
Happy New Year, sir.
And advance Happy Valentine's.
Happy New Year.
Thank you.
Okay, now we shift to Health Undersecretary Maria Rosario Vergere. Ma'am, maraming salamat for coming back to us tonight. It's been a while.
Hi, ma'am.
Good evening po.
Good evening po.
Yes,
Magandang
ma'am.
gabi po sa inyo. Good evening to all of you.
Thank you for joining us. Ma'am, of course, the numbers are of concern. We're looking at 46, I think, percent positivity rate today. Malapit na tayo sa 50. And as it is po, Metro Manila pa yung driver ng infections, which is probably the best vaccinated region in the country. Which also brings the question, what are the chances that we'll have an even bigger spike if Omicron or COVID-19 also surges in the countryside where vaccinations are not as good as Metro Manila? Looking forward for the next 2 weeks, what are we looking at? Mukha bang lalaki pa to?
Well, our hope is we will be able to stop the transmission in our communities, especially now that we are ramping up vaccination, and especially that our healthcare systems are being preserved among the severe and the critical. We are looking at increasing number of cases for the next days, at least, and hopefully we'll have our peak so that the decline will happen at once. What we are seeing right now, especially here in NCR, which, as you have said, is the driver of transmission. The numbers are increasing, and based on our projections, it's really has been it matched the projections that we have as to the number of active cases and as to the number of cases per day. We are seeing milder infections right now compared to our Delta experience,
Yes,
but
ma'am.
the numbers really are huge, and we are seeing that it can still grow or it can still increase in the coming days.
For example, when we've heard the Calabarzon and Region 3, tumataas na rin yung numbers nila, and they're looking at what? I think 40% vaccination lamang of the whole population.
Yes, sir. So hindi lang po sa Metro Manila mangyayari ito. So nakikita na ho natin sa ibang regions. And hopefully, before it reaches the other regions, we're able to do some efforts already to stop the transmission in the communities. As for now, it is really Metro Manila or NCR, which comprises about 70% of the cases that we have right now. And then the rest would be the big areas near Metro Manila as well. So hopefully by the time that the increase will stop, we will not be able to see increases also in the other regions.
Yusek, kanina nabasa ko sa Philippine Star. I hope I'm getting this right. But I think yung PGH, they had a story on the PGH. They were saying yung mga nakikuha nilang mga kaso, 50-50 vaccinated, unvaccinated. The difference being yung mga unvaccinated, pumapasok talagang symptomatic. And sinabi nila karamihan ng mga pumapasok na vaccinated, actually incidental lang. They come in for other reasons. And then since nasa hospital, they have to get tested and then dun lang lumalabas. Now, the bright side there obviously is that asymptomatic yung mga vaccinated, talagang hindi nila nararamdaman, wala silang kamalay-malay. But is the downside there obviously that, I mean, as a lot of people suspect, ang daming kaso, lalo na mga asymptomatic na hindi natin namamalayan?
Yes, no. So evidence states that in the experiences from other countries, for this specific na nangyayaring pagtaas ng kaso, you can estimate because you might be infected as well already with this high transmission in the community. Ito pong sa PGH na nangyari, kailangan maklaro natin sa ating mga kababayan. Yun pong kanilang mga naka-admit sa kanila when we tried analyzing with them. Over the weekend, they had 71 admissions. Yung 67 po dun sa admission nila were coincidental, kaya nakuha yung COVID. 4 lang po talaga ang pumasok na may COVID. Kaya yung pong mga kumakalat na ang bakunado, naapektuhan, so on and so forth, we need to be clear on that. Na pumasok po sila, vaccinated sila, but for other reasons, and they were found to have COVID and they did not experience severe symptoms. So ito po, tinignan din namin sa mga ospital namin dito sa buong Metro Manila, ganun din po ang mga kaso. Mas marami ang ina-admit because of other conditions, and then later on they find based on testing na positive but not really for COVID. So ngayon ang pinapakita talaga milder symptoms compared to Delta. Ang atin pong mga pagkaka-ospital ngayon pag kinompare natin with our Delta experience, much more less than our Delta experience. If you would notice, kahit gaano ka na kataas ang mga kaso ngayon, our health systems lumalaban po, nasa almost 50% pa lang ang capacity natin, and we are continuously expanding. So hopefully we can be able to sustain and our health systems will not get overwhelmed.
Pero Yusek, ang problema dyan, the healthcare workers now are starting to get infected and they are fully vaccinated. Saka nagrereklamo din yung mga nurses group dun sa policy to shorten their isolation pag na-infect. Ano po yung magagawa natin? In PGH and San Lazaro, they're feeling it already. Kaya we have enough beds, we don't have enough healthcare workers. Anong magiging response natin sa ganyang problema?
Yes, ma'am. That's true naman. And sila rin po, katulad natin lahat, ay nai-infect na rin because of this high transmission. Yung incubation period nitong Omicron napaka-ikli compared to the Delta. In 2 to 3 days, you get infected already. At marami na po talaga mga healthcare workers natin ang talagang nagkasakit. Kaya po tayo nag-issue ng policy for contingency. And this is based on evidence. We have adopted this from the guidelines from CDC. Kung saan sinasabi naman po talaga when you are vaccinated, especially when you are boosted, mas mababa ang viral load natin. And that's why we have implemented that among our healthcare workers na paikliin natin ang quarantine at saka ang isolation period para hindi tayo masyado nawawala ng manpower. Aside from this policy shift, we also have asked the assistance already of our uniformed personnel. Nakipag-usap na si Secretary Duque with our other national government heads kung saan yung pong mga military healthcare personnel are going to be deployed also in our hospitals.
Yusek, ano pong plano sa testing? Dahil nga nagkakaubusan na ng mga testing kits, I know that you have allowed the use of antigen, pero yung DIY hindi pa rin po yata pinapayagan. Will it ever come to a point where hindi na natin matatrack talaga yung real numbers and And if so, how risky, how dangerous could that be?
Well, we've come to that point where the value of testing is really for clinical management. Nung nauuna pong mga phases natin sa pandemya, napaka-importante because of surveillance purposes. We need to know who are positive, who are negative, so that we can be able to isolate, to quarantine them away from the population. Ngayon na ang dami nating kaso, transmission is ongoing and very, very fast transmission. Ang value na po ngayon ng testing is for clinical management. That's why we are shifting our policy, no? Pinag-uusapan na po with our experts that we should be able to prioritize our testing, no? Ang testing dapat, clinical management, i-prioritize natin yung mga vulnerable natin, senior citizens, those with comorbidities, yung mga immunocompromised, our healthcare workers. Aside from that, if it's for the community, we use antigen tests, especially if they are symptomatic or they are close contacts, we can use antigen. So ito po yung ngayong mga plano natin for us to do shifts in policy because ganito na po yung stage ng transmission sa ating bansa. And just to be clear, ma'am, our kits, we have sufficient stocks for now. Ang problema natin ngayon po would be the sudden increase in demand. Kung saan nagkakasakit din po ang laboratory personnel tapos biglang dagsa po ng kutakot-takot na tao, no? Na even those who are not part of the targets of our laboratories come to them. Kaya po talagang na-overwhelm yung sistema natin at nagkaganyan. Pero ang ating abiso, no, para lang sa ating mga community who are having mild and asymptomatic conditions, please isolate. Kahit wala pa kayong hawak na test, mag-isolate na ho tayo so that we can stop the transmission in the community.
Ma'am, clarify ko lang po. Do you mean to say kanina when you spoke about the RT-PCR tests, do you mean to say that the government plans to regulate or limit RT-PCR testing to only the vulnerable and to healthcare workers, just to make sure that we have enough for them to go around?
Yes, not really to limit, no, but we are going to prioritize. No, this is a shift in policy. And this is, of course, yet to be approved and consulted. Pero iyan na po yung pinag-uusapan ngayon with the experts. Because right now, if we try to see, ang dami na pong taong hindi nakaka-access sa serbisyo. At ang isang pinakatamaan po itong ganitong nangyayari sa atin ay yung vulnerable.
Yes,
Marami pong nakabinbin sa admissions kasi hindi sila makakuha ng test because nadidelay ang turnaround time. So how do we now try to address this problem? Magpa-prioritize muna po tayo hanggang sa umayos po uli ang ating sistema. And that is what we are thinking of, pinag-uusapan. Wala pa hong approval, but this would be the direction, no? Kung sakasakaling maaprubahan po tayo, this will be done, no? Hindi natin lilimitahan ang test for our community. We will have the antigen test sa ating komunidad. Meron na hong 2 suppliers and manufacturers na nag-apply for the self-administered test kits sa FDA. Ine-expedite yun ngayon.
Yeah. But should we be disturbed that many people are choosing to not be tested at all? For fear na, nako, pag nalaman na positive ako, baka isolate pa ako, ayoko ma-isolate. Is it something that we should watch out for? Kasi baka mamaya naman, ibang pandemic naman ang magiging bunga nun. Hindi kaya. Kasi ang dami ko nang kilala rin na hindi na lang nagpapatest. Ina-assume na lang nila na siguro nga Omicron to.
That is that's what's happening right now. That's our reality right now, ma'am. Marami po talaga hindi na nakaka-access ng testing. Ang pinaka-importante, people are self-regulating. Pag tinignan po natin ngayon, pamilya hindi na lumalabas ng bahay, pamilya nag-isolate na po. If you go out of the streets, makikita mo walang laman, wala tayong traffic. Kasi people are self-regulating. Sila na ang nag-isolate sa sarili nila at sa pamilya nila. Establishments are closing for 2 to 3 days just to disinfect. May ayos nila kung sino may symptoms at wala. Everybody's helping in this regard, no? So kung sakasakali po, ito pong sinasabi natin, I think it's of benefit to us, no? Because people, even without a test, are now isolating themselves.
Yeah. Ma'am, to that point, yung sa self-regulating, I'm asking this on behalf, frankly, my family, and I think it's typical experience for so many households right now, na bawat household merong nag-test, merong positive, pagkatapos may kasama kayo sa bahay na negative. And then nagkakalituhan na. Kailan ako magbibilang kailan ng day 0 ko? Kailan ako magbibilang ng day 1?
Correct.
Day 10? Yung positive, iba ba yung bilang doon sa close contact namin? But I guess my question is, should we just assume that everybody counts on the day that somebody tests positive or displays a symptom, whether or not nag-negative or positive? What's the easiest way for a household with mixed results to count and to be responsible with their protocol?
Yes, sir. No? So napaka-common po ng question na yan. Ano? And ang akin pong ma-advise, no, as soon as one person tests positive, lahat kayo close contact. Walang hindi close contact yan sa loob ng household. So hindi ka man isolated, you quarantine because you're a close contact. And you count the same days as the one na nag-positive po, na nag-isolate siya, kayo naman naka-quarantine. Ngayon po, may mga shortened protocols po kasi tayo. Katulad po nung sa isolation, ito po 10 days pa rin hanggang sa ngayon. Pero ang quarantine, kapag fully vaccinated ka, 7 araw na lang po kung close contact kayo. Pero kung ako po ang tatanungin, because exposure was continuous, you have to count, no? Baka sakasakaling nung time na nagkaroon siya ng positive ay nakapag-mix pa kayo o kaya nag-serve pa kayo ng food sa kanya, you count from that day and then you count your 7 days. And then of course, you always have to wear your mask kahit saan kayo pumunta. Yang 7 araw, 10 araw, gusto natin makasiguro po tayo para sa lahat, para hindi na nagkakahawa-hawaan. Kahit sa loob ng bahay, isuot po natin yung mga mask na yan.
Yusek, isa pa, medical consultation. Kasi maraming nagkakasakit ngayon. Fully vaccinated, boosted. Tapos ayaw na nilang nagsa-self-medicate na lang eh. Kaya ba nung kung mild symptoms lang or asymptomatic, kaya na bang gamitin nyo ng paracetamol lang? Do people, not me, hindi ako, do people need molnupiravir, for example, kung ganun din lang naman, you're fully vaccinated, you're boosted? Kaya na ba yun ng Biogesic, saka ni Joseph siguro, o BioFlu, or whatever?
Tandaan po natin, ang COVID-19 is a virus.
Yes.
Ang virus po, self-limiting disease yan. So kahit po hindi kayo mag-antibiotics, matatapos po ng 3 to 5 days ang sakit na yan. Ngayon, iba po ang kaso kasi kapag ikaw ay vulnerable. Mas i-expect natin, mas binabantayan natin, baka mag-progress ang sakit mo. But for a healthy individual who is not a senior citizen, nagkasipon, nagkaroon ng sakit ng ulo, paracetamol is enough. Yun pong molnupiravir, I just need to clarify it to everybody. Binibigay lang po yan para sa mga high-risk individuals. You cannot take that if you are young and healthy. Hindi po yan para sa...
Nako, Sister Concepcion, nagbigay daw ito.
Sa high-risk lang natin binibigay. May mga condition po yan na sa product label po, binibigay natin yung gamot na yan para dun sa mga specific na tao na may high risk to progress to severe illness ng COVID-19. But not for everybody. Ang pinakamaganda po, para sigurado rin kayo, ang dami ho nating telemedicine hotlines tsaka LGU hotlines. We can always call for guidance from our doctors.
And molnupiravir is a prescription drug, di ba?
Yes, you can only get that with a prescription. Actually, ang mga ospital po natin, meron po niyan. Dahil po binigyan naman natin sila ng pera, they were able to procure. Pero binibigay lang talaga for high-risk patients within the first 5 days of symptoms.
So kung gusto mo lang alisin yung sipon mo kasi natatakot ka na, baka nga hindi ka na nagpa-testing, you're vaccinated, you're boosted, but you have a cold, you take Decolgen siguro, okay naman yan.
Yeah, that's just to relieve your symptoms,
Yeah,
yung mga Neodep, ganyan. Pero hindi nila yan titigilan, yung virus will be with you. Paniwalaan po natin yung bakuna tsaka yung booster natin, bibigyan tayo ng protection niyan. I can tell you and I am confident to say that vaccines are helping us right now.
Ma'am, I'll go back to
Okay,
testing.
ma'am, yung mga gustong magpa-booster, ano ba ang safe parang time allowance para magpa-booster, especially if you were exposed or if you yourself became positive? I mean, dapat pwede bang magpa-booster na kaagad dahil wala na yung fever ko? Or what's a safe period of time?
As soon as your symptoms are resolved, you have completed your 10-day isolation or you have completed your quarantine period, you can already have your booster. Basta walang non-symptomas, nakatapos po tayo dun sa required period.
Okay. At pag nagpa-booster, is immunity necessarily low during that time? And so we should be careful not to be exposed, parang ganon. Kasi marami nagsasabi, wag muna tayo magpa-booster dahil sa pamilya namin, dalawa nga yung positive, baka lalo pa ako mahawa. Is that, safe po ba yun? Tama po ba yung ganong mentalidad na wag mo na magpa-booster dahil may exposure pa eh. Siyempre, pag nagpa-booster ako, di ba, baba pa yung defense ko, di ba? Tama ba yun?
Hindi po ganun, ano? So, irrespective, kapag pwede na, magpa-booster na kayo because that's your protection, additional protection for you. Yun pong mga na-expose, kailangan lang nga po matapos yung quarantine period nyo na required, tsaka kayo magkaroon ng booster. Kasi maaaring mag-develop kayo ng symptoms dahil na-expose kayo at maaari po makapanghawa pa kayo ng iba. Pero pag nakatapos na kayo, wala hong katotohanan na bumababa ang immunity, hindi pa dapat magpa-booster. Kasi kahit po mataas o mababa immunity natin, kailangan pa rin natin magsuot ng mask o mag-follow ng safety protocol so that we don't get infected and we don't infect others if ever.
Ma'am, I'll go back to testing. Secretary Vince Dizon was quoted as saying na our testing capacity is at around 80,000 tests per day. I don't know if that's an accurate number, pero galing kay Secretary Dizon yun eh. Pero at the same time, when I looked at our testing in the past few days, we were hitting 77,000 tests eh. So we're almost at, assuming that's the correct number, yung 80,000, we're almost at the limit of our testing capacities and we're still getting higher. So I'm wondering lang, is there a reason to be concerned here?
We've reached 90,000+ during the Delta experience, and we only have added additional licensed laboratories already since the time that we had Delta. So
Okay.
our capacity, more or less, will reach 100,000 already. Kaya po natin. Sabi ko nga, these testing kits, sufficient pa po as of now. Meron po tayong
Okay.
stocks ngayon eh. Yun lang po talagang choke po yung proseso natin because biglang dami, tapos nagkasakit po yung mga taong gumagawa.
Ma'am, kanina po nabanggit nyo na pagdating sa testing, may konting paradigm shift tayo. No? Parang it's value now, as you said, it's really in clinical treatment. Does that down the line have implications as well on whether or not we need to reframe our capacity and appreciation for contact tracing? Kasi yan, nasi-stress din ngayon. And then, frankly, right now, lahat ng tao is, hindi naman sa wala ng pake, pero ang attitude nila is, lahat tayo, mukhang magkakaroon na lahat ng household, mukhang tatamaan na lahat ng household. How do we look at contact tracing now, vis-a-vis both our capacity as well as the reality of how widespread the virus is right now?
Well, right now, as I can say, sir, based on evidence, we are having this very high transmission rate. Ang contact tracing po, hindi na po ganun of value, no? Because everywhere you look, dun sa community nyo, pagka-symptoms kayo, alam nyo, kahit di kayo magpa-test, may sakit na kayo. So ngayon po, pag ganito kataas ang transmission, ang contact tracing hindi po masyadong of value yan sa atin. But we are not removing it from our package of interventions, especially in other regions na hindi ganito ang transmission. Napaka-importante pa po yan. Pero dito sa NCR ngayon, ang contact tracing per family na po tayo. Isang pamilya lang ang may sakit sa isang pamilya. Alam natin magkakaroon lahat yan. Because of that interval of time that this Omicron spreads. Ganun kabilis. Kaya po, dito sa atin sa NCR, contact tracing, hindi na natin siya masyadong ine-employ. But for the other regions, that would still be very important. And the DILG has assured us na meron po tayong mga contact tracers na i-rehire at gumagana pa rin po para sa ibang mga regions natin.
Yusek, what's the latest sa supply ng paracetamol natin? Nag-stabilize na ba? Kasi kagabi, I went around several drugstores, mahaba pa rin yung mga pila ng mga tao.
Actually, ma'am, hindi lang paracetamol. I think people really are lining up for different types of drugs, over-the-counter drugs. No? So, yung mga tao with their symptoms right now, sila na po nagagamot sa sarili nila. Pati po yung mga usual na cough and cold medicines, sinasabi nung iba, wala na daw. Pero our Pharmaceutical Association of the Philippines has assured us, no, suppliers and manufacturers are doubling their time and efforts para po makapagpasok na mas maraming supplies. Hopefully, over the next few days, mag-stabilize po tayo. Meron na ho kaming reports na kapag deliver na ng mga paracetamol with these specific brands in a different suppliers or retailers na malalaki. So sana po sa coming days, no, makapag-stabilize. I just like to ask kung pwede akong makiusap sa ating mga kababayan. Huwag po tayo
Sige
mag-board.
po, ma'am.
Oo, bumili lang tayo ng sapat para sa pamilya natin. Isipin din po natin yung iba, no? So let's try to not do this kind of hoarding and other things para po naman lahat po ay makapagbenepisyo sa mga gamot na kailangan natin sa ngayon.
Kahon-kahon yung binibili, kahon-kahon.
Sino bumibili niya?
Nakita na dun sa isa, ganyang kalaki.
Oy, ako 2 banig lang naubos niya.
Kung hindi niyo pa naman kailangan, bumili lang kayo online.
May limit na.
Huwag na kayo pumila. Huwag na kayo makapagsiksikan sa butika. Okay. Maraming salamat po, Health Undersecretary Maria Rosario Vergere. Thank you for joining us tonight.
Thank you.
Thank you, Yusek.
Maraming salamat po.
That'll be all for this Monday edition of the Chiefs. We hope what is discussed here will keep the conversation going. Before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Edlin Gao.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.